Samantha is a 5-year-old superstar. She is extremely outgoing and social. Everyone that she meets and has interaction with just falls in love with her.
It's hard to describe when a person her age can be so in tune with people and people's feelings, but she is.
She has a very infectious personality, very caring, very sweet, very curious, asks a lot of questions.
Anytime you say a word, once you tell her, like, she knows. She's very present.
When we learned that Samantha had Moebius syndrome, I had a typical normal pregnancy. She was measuring small, so I was induced.
After a couple of hours, doctors, they were having a really hard time getting her to feed, and you could tell there was just something different about her mouth, the way her mouth wasn't closing, so they sent her to the NICU.
It was a possibility, it was thrown out there, but no one had ever really seen anyone with Moebius syndrome, knew about Moebius syndrome. It was confirmed about 3 days after she was born by a geneticist and then also an ophthalmologist. Moebius syndrome has so many different levels to it and so many different things that could be wrong that when they say that your kid has Moebius syndrome and you have no idea what to expect, it's kind of like, okay, she's not going to ever be able to smile, she's not going to be able to speak, she's not going to be able to walk. Like, there's all of these things.
The thing about this surgery that I think is so important for kids, especially now that she's getting older and she's in school and kids are starting to notice that she's a little different.
She doesn't understand why she has a little sister that can drink from a straw, and her little sister can eat quickly and doesn't get messy, and so she's been questioning it a little bit more and really not understanding why her mouth is broken, is what she says.
She knows that she's different. I just want her to be comfortable and be happy.
She's done very well with the cards that have been given to her having Moebius syndrome. She's compensated in all ways that she can. Her tongue does not move laterally, so she's figured out how to use her finger to move food to the size of her mouth. She's not the strongest person. She does have muscle weakness, which is a part of Moebius syndrome, but she tries her hardest. This girl tries and tries and tries. She was in her dance class. She's the smallest one. You see her stretching among all these girls that are younger than her. She's this tiny thing, and it's just killing her, but she keeps doing it because that's what she has to do.
Dr. Panossian performs 2 different types of surgeries for the smile surgery, and he went through both of them with us, and this one was far less invasive. The recovery time was a lot shorter, and also the actual time it takes for the smile to work is extremely shorter.
We felt very confident in Dr. Panossian. He seemed to be very confident in it as well.
He devoted all of the time that we needed to us. He wasn't in a rush. He wasn't trying to tell us what to do.
He's taken a lot of time studying it and kind of perfecting it and tweaking it to get the success that he wants to see from it. And if all that goes well, we're going to be such a huge advocate.
Sam is absolutely looking forward to her new smile. She sits in front of the mirror and takes her finger and presses it up on the side that does not work.
She's such a happy person that I'm really hoping now that her face can emulate just how happy and excited she is, and I think she is looking forward to that as well.